Hello everyone, I am Dr. Sharath Babu, a consultant orthopedic surgeon and arthroscopy and sports specialist working at Care Hospital, HITEC City. Today we'll discuss about commonly seen shoulder pain and shoulder problems. So if we take a shoulder and the causes of pain, first thing we'll daily routinely see in the outpatient department is frozen shoulder. That means stiffness and stiffness in the shoulder, difficulty in doing overhead activities in lot of patients. This is most commonly seen in diabetics, so who are having some uncontrolled sugars and long-term diabetes. In those patients, we commonly see a frozen shoulder or adhesive capsulitis. And in patients who are elderly, so with a minimal trauma, with a simple fall on outstretched hand, they also have the same kind of problem over a period of time, develop the same kind of problem like difficulty in doing overhead activity. So that is also because of tear in the rotator cuff muscles, which comes and attach over the arm bone from posterior to anterior. So 4 muscles will form a cuff-like thing, they'll attach on the arm bone. If they are completely intact, then only we can be able to do the overhead activities properly. So when any injury happens, if you are not moving your shoulder, then that will lead to a frozen shoulder. That will cause a difficulty in overhead activities and difficulty in doing external rotation, internal rotation. So how to evaluate these patients? So basically first thing to rule out is examination. But in case if it is completely frozen, so we can't get complete information what is the status of the muscles inside the joint. So for that, first what I'll do is I'll advise the patient for an MRI and evaluate them. If any tear is there in the shoulder, then we need to go for a surgery and fix the tear with the help of a arthroscopy surgery. Arthroscopy is a keyhole surgery, but around 2 to 3 keyholes around the shoulder joint, we can complete the surgery. We can repair the cuff tear, and then we can give them a pain-free shoulder, and we can bring back all the movements. If the tear is not treated, if you are going for a physiotherapy, then the pain won't subside, and frozen shoulder also it won't improve. So basically, if tear is not there, only frozen shoulder is there, then we'll go for a simple injections for reducing the inflammation in the joint and to increase the volume of the capsule. We'll give an injection in the joint so that with minimal simple injections we can achieve the complete range of motion. So proper evaluation before going to anything, because lot of people, they don't know what's happening. They'll won't go for a proper evaluation. They'll go for a physiotherapy. They'll be having lot of pains and stiffness will be like that only. So my advice will be go for a proper evaluation. If any tears are there, we can do a arthroscopy surgery. And if it is a completely frozen shoulder, medications, small injection into the joint, and physiotherapy will help you. So for any pain, just proper evaluation and examination is needed. Do consult a doctor before it gets worsens. Thank you so much.